Welcome back to the Men's Health 60 series. In our previous video, we discussed when to see a doctor for erectile dysfunction, commonly known as ED. Today, in video 4, we'll explore the most common medical treatments to address this condition. If you're experiencing ED, don't worry, you're not alone, and there are many effective solutions available. However, the most critical step is to consult a doctor before starting any treatment. Let's dive in. Part 1. Pharmacological treatments for erectile dysfunction. Erectile dysfunction, ED, is a prevalent condition in men, and phosphodiesterase type 5, PDE5 inhibitors are the first-line treatment due to their ability to enhance blood flow to the penis, facilitating the achievement and maintenance of an erection. In this section, we'll delve into the two most widely used medications, Viagra, Sildenafil, and Cialis, Tadalafil, supported by scientific evidence, side effects, and key precautions. 1. Viagra, Sildenafil. Overview. Approved by the FDA in 1998, Viagra was the first PDE5 inhibitor, marking a breakthrough in ED treatment. Administration. Taken approximately 30 minutes to 1 hour before sexual activity, with effects lasting about 4 hours. Dosage. The typical starting dose is 50 mg, adjustable to 100 mg or 25 mg based on individual response. Efficacy. A 1998 study in the New England Journal of Medicine reported that 74% of men using Viagra experienced improved erections compared to only 16% in the placebo group. Side effects. Common. Headache, 16%. Facial flushing, 10%. Dyspepsia, 7%. Nasal congestion, 4%. Myoclonic. Rare but serious. Sudden vision loss or prolonged erection, priapism, requiring immediate medical attention. 2. Cialis, Tadalafil. Overview. Approved by the FDA in 2003, Cialis is distinguished by its long duration of action, up to 36 hours, earning it the nickname, the weekend pill. Administration. Can be taken as needed before sexual activity or as a daily low-dose regimen, 2.55 micro, for continuous efficacy. Benefits. Its extended duration offers greater flexibility in planning sexual activity. Efficacy. A 2004 study in European Urology demonstrated that Cialis significantly improves erectile function in older men and those with ED due to diabetes, Tadalafil for ED. Side effects. Common. Headache, 11%. Back pain, 5%. Facial flushing, 3%. Rare. Similar to Viagra, including risks of priapism or visual changes. 3. Mechanism of action. Both Viagra and Cialis are PDE5 inhibitors, working by inhibiting the enzyme phosphodiesterase type 5, which enhances nitric oxide levels in the body. Nitric oxide relaxes penile blood vessels, increasing blood flow during sexual stimulation. Research. A 2005 meta-analysis in the Cochrane database of systematic reviews found that PDE5 inhibitors improve erectile function in 67–89% of men, depending on dosage and the underlying cause of ED. 4. Side effects and drug interactions. Side effects. Common. Headache, flushing, dyspepsia, nasal congestion, dizziness. Serious. Sudden vision or hearing loss, extremely rare, 0.1%. Priapism, erection lasting over 4 hours, requiring emergency care. Drug interactions. Nitrates, concomitant use of Viagra or Cialis, with nitrates used for angina, can cause life-threatening hypotension, as warned by the American Heart Association. Other medications, antifungals, ketoconazole, or antihypertensives may increase the risk of side effects. 5. Key precautions. Not suitable for all. Efficacy depends on the cause of ED. For instance, severe nerve damage may reduce responsiveness. Cardiac considerations. Sexual activity can strain the heart. so a cardiovascular evaluation is essential before use. Mandatory physician consultation. A doctor will determine the appropriate dosage and check for drug interactions. A Journal of Sexual Medicine study found that patients under medical supervision report higher satisfaction and fewer side effects. Physician-guided treatment for ED. 6. Conclusion. Viagra and Cialis are highly effective PDE5 inhibitors, backed by robust scientific evidence. However, they carry risks of side effects and dangerous interactions, particularly with nitrates. Always consult a healthcare provider to ensure safety and optimize outcomes. Part 2. Hormone Therapy for Erectile Dysfunction. Hormone therapy, specifically testosterone replacement therapy, TRT, is a treatment option for erectile dysfunction, ED, when low testosterone levels are a contributing factor, particularly in older men. Below are the key aspects of this therapy. 1. Overview. ED can sometimes result from declining testosterone levels. If blood tests indicate testosterone levels below the normal range, typically 300 ngstl, a doctor may recommend TRT to restore testosterone and improve symptoms. 2. Administration methods. Testosterone can be administered through injections, delivered directly into the muscle, typically every 2 to 4 weeks. Patches, applied to the skin for gradual absorption. Gels, applied daily to the skin for transdermal absorption. Subcutaneous pellets, implanted under the skin, releasing testosterone over 3 to 6 months. Each method has its advantages and drawbacks, and a doctor will recommend the most suitable option based on health status and personal preferences. 3. Benefits. Hormone therapy offers several benefits. Improved libido and erectile function. By normalizing testosterone levels, TRT enhances sexual desire and performance. Overall health improvement. Testosterone can boost energy, mood, and muscle strength. 4. Risks and side effects. Despite its efficacy, TRT carries risks. Increased risk of blood clots may lead to thrombosis, particularly in older men. Prostate issues can enlarge the prostate or exacerbate underlying conditions like prostate cancer. Sleep apnea. TRT may worsen this condition. Other side effects include oily skin, acne, or reduced sperm count. 5. Monitoring. Due to these risks, medical supervision is mandatory. Regular monitoring of testosterone levels, blood counts, and other health markers. Dosage adjustments or discontinuation if serious side effects occur. 6. Conclusion. Hormone therapy is an effective option for men with ED due to low testosterone, but it requires close medical supervision to ensure safety and efficacy. Part 3. Assistive Devices for Erectile Dysfunction. Next, we explore assistive devices, an option for those who cannot use medications or find them ineffective. The two primary devices are vacuum erection devices, VEDs, and penile implants. Below are details on their function, efficacy, scientific data, and precautions. 1. Vacuum erection device, VED. A. Mechanism of action. Description. A VED is a non-invasive device consisting of a cylindrical tube placed over the penis and a pump, manual or electric, that creates negative pressure to draw blood into the penis, inducing an erection. A constriction ring is then placed at the base to maintain the erection. Duration. Per Mayo Clinic, achieving an erection typically takes 2 to 3 minutes, with the constriction ring sustaining it for up to 30 minutes. B. Efficacy. Data. A Journal of Sexual Medicine study reported that 50–80% of men are satisfied with VEDs, vacuum erection devices for ED. Advantages. Easy to use at home, non-invasive, minimal serious side effects. Disadvantages: requires practice for proper use, may cause discomfort or minor bruising. C. Risks and precautions. Side effects: mild pain, bruising, or a cold sensation in the penis. Per Cleveland Clinic, improper use, such as prolonged ring application, can cause tissue damage. Contraindications: unsuitable for individuals with bleeding disorders or those on anticoagulants without medical guidance. 2. Penile implant. A. Mechanism of action. Description: a surgical procedure involving the implantation of inflatable or semi-rigid rods into the penis to enable erections on demand. Inflatable: inflated when needed and deflated afterward. Semi-rigid: permanently firm but bendable. Duration: surgery lasts approximately 1 to 2 hours, with patients typically discharged the same day or after one night. Mayo Clinic, penile implants. B. Efficacy. Data: a Journal of Urology study found that over 90% of men are satisfied with penile implants post-surgery. Advantages: high reliability. Long-term efficacy: 10 to 15 years. Disadvantages: invasive surgery with potential complications. C. Risks and precautions. Side effects: infection risk 1 to 3%. Device failure 5 to 10% after 10 years, or post-surgical pain. Contraindications: not suitable for patients with severe conditions like uncontrolled diabetes or significant cardiovascular disease. 3. Importance of physician consultation. These devices can be effective but require proper guidance, especially for implants, which involve surgery. Consult a doctor too. Select the most appropriate method for your health condition. Avoid risks like tissue damage or infection. Ensure optimal outcomes. A study in the International Journal of Impotence Research found that patients using devices under medical supervision report higher satisfaction and fewer complications. 4. Conclusion. Vacuum erection devices and penile implants are effective solutions for ED, particularly when medications are unsuitable. However, to ensure safety and efficacy, always consult a healthcare provider to understand the benefits and risks and make an informed decision. Part 4. Importance of physician consultation. Throughout this video, we've emphasized the critical need to consult a doctor before trying any treatment. ED is not just an isolated issue. It may signal underlying conditions like cardiovascular disease or diabetes. A doctor will diagnose the root cause of ED, recommend treatments tailored to your health status and current medications, monitor for side effects, and make necessary adjustments. Part 5. Conclusion. In summary, medical treatments for erectile dysfunction, ED, include medications like Viagra and Cialis, hormone therapy, and assistive devices. Each approach has its own benefits and limitations, but the key is to work closely with a doctor to find the best solution for you. Choosing the right treatment not only improves sexual function, but also ensures overall health safety. If you're experiencing ED, don't hesitate to seek help. Early intervention can enhance your quality of life and uncover potential health issues like heart disease or diabetes. Take action today to protect your health. Join us in our next video, where we'll explore lifestyle changes to improve ED. You'll learn how exercises like walking and yoga, a healthy Mediterranean diet, and stress reduction techniques can naturally and sustainably support ED improvement. Don't forget to like, subscribe, and share this video to spread valuable information to others. See you next time.